Did you know that over 68% of seniors in the US take daily vitamin supplements, thinking they're doing the right thing? But here's the shocking part. Several of these so-called health boosters, when taken in the wrong dose or for too long, have been linked to weakened muscles, slower reflexes, impaired mobility, and even a higher risk of falls and fractures. Yes, something meant to help you could actually be making your legs shake, your balance worse, and your independence vanish, one capsule at a time. This isn't fear-mongering. It's what recent studies from leading US medical journals are warning us about. And it's time we listen. So if you or someone you love is over 60 and takes daily vitamins, you cannot afford to miss this. Before we dive in, don't forget to like, share, and subscribe to Elderly Health Tips, your go-to channel for real, science-backed advice to age stronger and smarter. All right, now let's take a look at 3 types of vitamins that can actually harm your legs if you're over 60. Vitamin 3. Vitamin B6. Let's take a deep dive into one of the most overlooked but most dangerous vitamin risks for older adults today. Vitamin B6 toxicity, a hidden cause of nerve damage and loss of mobility. According to the National Institutes of Health, NIH Office of Dietary Supplements, the recommended upper intake limit for vitamin B6 in adults is 100 milligrams per day. Anything above that, especially over prolonged periods, significantly increases the risk of sensory neuropathy. In fact, a landmark report published in the Journal of Clinical Neuromuscular Disease, 2014, documented that patients taking between 200 milligrams to 500 milligrams of B6 daily, sometimes unknowingly, began experiencing symptoms such as foot numbness, difficulty walking, loss of proprioception, not knowing where your limbs are in space, burning sensations in the legs and hands, permanent nerve damage in some cases. A meta-analysis from the American Academy of Neurology in 2020 showed that neuropathy from B6 overuse was one of the top 5 iatrogenic, doctor or drug-caused nerve disorders seen in elderly clinics across the country. Let that sink in. This wasn't caused by a disease, but by something as simple as a supplement. As we age, our kidneys become less efficient at excreting excess vitamins. This is particularly true for water-soluble vitamins like B6, which people assume are safe because they're not stored in fat like vitamin A or D. But in seniors over 60, studies have shown that renal clearance of B6 drops by up to 25 to 30%, according to research from the University of Washington School of Medicine. That means even a safe dose of 80 milligrams per day, when taken chronically, can become toxic in someone with mild kidney impairment. And many seniors don't even realize their kidneys are slowing down. Here's where things get tricky. Vitamin B6 isn't just in your multivitamin. It hides in all sorts of health products. Brain-boosting pills, commonly marketed with 50 to 100 milligrams per serving. Energy drinks, up to 40 milligrams per can. Meal replacement shakes, immune support powders, fortified cereals, and protein bars. A study in JAMA Internal Medicine found that 32% of older Americans who took daily supplements exceeded the safe upper limit of B6, often without even knowing it. Here's the thing, no supplement label will tell you. Losing sensation in your feet isn't just a medical issue. It's a blow to your dignity. When you can't trust your legs, avoid stairs. Stop going out. Depend on others to help you bathe or move around. This leads to a cascade of emotional effects: loss of independence, anxiety, depression, and a shrinking world. What can you do about it? Let's talk prevention and action. Check your supplement labels. Look for vitamin B6 or pyridoxine HCl. Total it up across all products. Stay below 50 milligrams per day unless a doctor specifically prescribes more. Watch for these red flags: tingling or numbness in feet or hands, balance problems, especially in low light. Invisible socks feeling, like something's wrapped around your feet, but there's nothing there. Muscle twitching or weakness. If you suspect B6 toxicity, stop all non-essential supplements. See a neurologist. Get blood work to measure plasma. B6 levels. Begin a physical therapy routine to protect against further muscle atrophy. Natural energy alternatives. Gentle morning walks, 10 minutes of sunlight exposure. Protein-rich meals with eggs, legumes, or fish magnesium, and B12 for nerve support, under supervision. Vitamin 2. Vitamin A. Vitamin A is fat-soluble, which means it builds up in the body over time, especially when taken through fish liver oils, fortified foods, or high-dose multivitamins. And that buildup? It can become toxic. Unlike water-soluble vitamins that flush out daily, vitamin A accumulates in the liver, bones, and fat stores. And when levels rise too high, it inhibits bone formation while ramping up bone breakdown. A large prospective study published in the New England Journal of Medicine followed 72,337 postmenopausal women over 10 years. It found that those with the highest intake of preformed vitamin A, retinol, had nearly double the risk of hip fractures compared to women with moderate intake. Even more concerning, the risk increased regardless of calcium intake. Another study from the American Journal of Clinical Nutrition confirmed that intake of over 1.5 milligrams per day, 5,000 international units, of retinol was significantly associated with reduced bone mineral density in the femur and lumbar spine, especially in older adults. And here's something most people don't realize. Bone density loss from vitamin A is strongest in the legs and hips. That's the exact area seniors rely on to stand, walk, and avoid falls. Evelyn, 76, came in with complaints of nagging pain in both hips and difficulty getting up from a chair. She had never smoked. No family history of osteoporosis. She even walked every day and drank milk regularly. But her DEXA scan showed advanced bone loss, particularly in her hip and thigh region. She wasn't taking any bone medications. But guess what? She had been on cod liver oil capsules, 10,000 IU of vitamin A per dose, along with a skin and eye support supplement containing retinol palmitate for over 5 years, totaling nearly 20,000 IU of preformed vitamin A daily. No one had told her it was too much. And by the time we caught it, the damage had already taken hold. Why is this so dangerous for older adults? Because it doesn't hurt at first. The damage is silent, slow, and easy to dismiss as just aging. But the consequences are real. Hip and thigh pain, muscle weakness when rising from bed, or a chair, reduced stride length while walking, increased risk of sudden fractures, especially after minor bumps or slips. And once you fracture a hip at 70 plus, your chance of regaining full mobility, or even independence, drops by more than 50%, according to the CDC. How does vitamin A sneak into your life? Here's where it gets tricky. Vitamin A, retinol, hides in cod liver oil supplements, up to 14,000 IU per capsule, anti-aging or vision multivitamins, fortified cereals and processed dairy prescription acne medications like isotretinoin for those with adult-onset acne. Even topical retinol creams, when used excessively, can slightly elevate blood levels over time, especially in those with thinning skin. Practical solutions to prevent damage. Check your supplement labels. Stay under 3,000 IU per day, 900 micrograms, unless your doctor specifically prescribes more. Prefer beta-carotene, plant-based vitamin A, instead of retinol. Your body only converts what it needs, so no risk of toxicity. Pair your diet with calcium, vitamin D3, and gentle resistance exercise to protect your bones. If you've been taking fish liver oil or high-dose A for years, ask your doctor for a bone scan and serum vitamin A blood test. Signs you may be overdosing on vitamin A: chronic hip, thigh, or back soreness. Muscle weakness, especially in the glutes and upper legs. Dry, peeling skin. Dizziness or blurred vision. Fatigue despite adequate sleep. If you're experiencing any of these, don't ignore them. It might not be just age. Vitamin 1, vitamin E. Vitamin E is widely praised for its antioxidant powers, helping skin glow, protecting the heart, and even slowing down aging. But here's what's rarely mentioned. It's fat-soluble, which means it builds up in your body over time, especially when taken in large supplemental doses. And when it builds too high, it doesn't make you stronger. It may do the exact opposite. According to a long-term trial published in the Journal of the American Medical Association, JAMA, doses exceeding 400 IU per day of vitamin E were linked to increased muscle weakness, poor balance and coordination, and even increased all-cause mortality in older adults when taken for years. Another study in the American Journal of Clinical Nutrition reported that high-dose vitamin E supplementation impaired neuromuscular control and contributed to leg instability in seniors, especially in those also taking blood thinners. That's because vitamin E interferes with vitamin K, affecting blood clotting. The result? A double risk: weak muscles and thin blood. A dangerous combo if you trip or fall. Why this matters more as we age. In younger adults, vitamin E excess might just cause nausea or headaches, but in older adults, it can contribute to muscle fatigue in the thighs and calves, loss of balance when walking, slower reflexes, higher chance of internal bleeding after a fall. These symptoms are subtle and often dismissed as just aging. That's why it slips under the radar. Where excess vitamin E is hiding, you might not even know you're overdoing it. Vitamin E shows up in anti-aging or heart health capsules, multivitamins with 100 to 400 IU per dose, fortified cereals or protein powders, skin oils and topical creams. Yes, absorption counts. And when you're combining multiple sources daily, especially with a high-fat diet, the risk grows without warning signs. Practical tips for older adults. Stick to 100 to 200 IU per day from supplements, unless advised otherwise by a physician. Check labels. Anything over 400 IU per serving should be a red flag, especially if you're on anticoagulants. Get regular blood work if you've been on high-dose vitamin E longer than 6 months. Favor food-based vitamin E, sunflower seeds, almonds, spinach, where overdose is nearly impossible. If you're already on blood thinners, like warfarin or apixaban, be extra cautious. The interaction can sneak up on you. Fast. Signs of excess vitamin E you shouldn't ignore. Leg weakness or trouble standing from a seated position. Feeling dizzy or unsteady, especially at night. Easy bruising or frequent nosebleeds. A heavy leg sensation without exertion. Muscle cramps in the calves or hips. If these sound familiar, it's worth checking your supplement routine. So here's the truth. Sometimes, the very thing we take to feel better can quietly work against us. Vitamin E isn't the villain. But when taken in excess, especially without monitoring or when mixed with blood thinners, it becomes a silent saboteur of strength, stability, and safety. If you or a loved one is over 60 and on supplements, don't just assume more is better. Review your labels, talk to your doctor, and watch your legs. They often speak before the blood test does. Because staying independent isn't just about walking, it's about walking strong and walking safe. If this helped you, please take a moment to like, share, and subscribe to Elderly Health Tips, where we translate complex science into practical advice for healthy aging. Together, let's keep you steady, one smart step at a time.